In the United States, there are approximately 3 million falls a year that result in emergency room visits. Knowing your risk for falls and taking the proper precautions to avoid these falls can assist in reducing that number and keeping you and your loved ones safe. I'm Nick Johansen, lead physical therapist for Salina Regional's Outpatient Physical Therapy Department.
Well, Nick, thank you so much for coming on the show. We're going to be talking about falls. Well, let's look at our areas of fall risk.
Sure, you can basically break it down to two factors, some intrinsic factors and extrinsic factors. So intrinsic factors will be things inside of our bodies that contribute to falls. So that could be a neurological condition like a stroke or somebody with multiple sclerosis or neuropathy. That could be just generalized weakness in an older adult. When we talk about extrinsic factors, we're thinking about things generally inside or outside of the home, outside of the person's body. So bathroom setup, not having adequate ability to use a grab bar or a slick mat in a bathroom, not having a walker or a cane if that's appropriate, not having handrails on a front porch, something like that. Those all contribute to an increased fall risk.
So if you see somebody that has some fall risk, you have them come into the clinic, what are some things that you do with somebody?
Sure, we'll initially take them through an assessment to see what factors are modifiable and what aren't. And then we'll generally do a combination of strength training and balance training, just depending on what that specific person needs.
If someone thinks they are at risk for fall, or maybe somebody that's watching this has a loved one that's at risk for fall, what are some things that they should do?
They can certainly talk with their doctor first and foremost and see if coming to outpatient physical therapy is an appropriate place for them to be. And then once they're in there, we can evaluate and see whether they need to address some of these factors or not.
Okay, how do you go through the evaluation with them?
We do a combination of strength and balance assessments, so we would have them stand up and demonstrate various skills for us. We'd get an idea of how well they get in and out of a chair, can they stand on one leg, those sort of things. Look and see how well they can go up and down stairs, things like that. Another way that you can determine whether you're at risk for falls is going to the Salina Regional website under the rehab section, and there's a fall risk assessment questionnaire on there as well.
If somebody has fallen, what should they do at that time?
Ideally, they would have something on them like a cell phone to be able to call 911 or a family member or something like that, because generally, yes, getting up can create other issues, or they may not even be able to get up from the floor or wherever they've fallen. So having something on them to get a hold of somebody else is going to be very important.
Well, Nick, thank you so much for coming on the show and for some great information. And thank you for watching. For more information, you may visit the rehabilitation page of srhc.com and like Salina Regional Health Center on Facebook. Follow us on X and Instagram.